Hi, everybody. I'm Angelina with Red Stick Mom. Thank you so much for joining us. Today, we have a really great conversation with a doctor regarding intimate wellness, women's health. This is a great topic that we think all of you are going to find very interesting and informative, and then you can ask questions as we go. So I'm going to add to the live. This is Dr. Ryan Dickerson. Hello, Dr. Ryan. How are you?
Doing well. Hello, everybody.
Great. So I was telling everyone we have a great conversation with you today with intimacy and women's health and wellness that I think for our Red Stick Mom followers can be really helpful.
Absolutely. Absolutely. I think it could be helpful for many people, many women in particular. And through my time as an OBGYN, I've realized how important this really is for people as they brought it up to me over the last, say, 15 to 20 years.
Great. So tell me about yourself. I know you work for Louisiana Women's Healthcare.
Yeah, that's right. I'm an OBGYN, a board certified OBGYN. I work with Louisiana Women's Healthcare. I've been here for almost 16 years. I'm a general OBGYN, taking care of everybody from, people, young women before they have babies, all the way through menopause until they're older. And so this is a part that affects women throughout their entire lives.
Yeah. What is your favorite thing about obstetrics or gynecology? What is it that brought you to this field?
Well, it used to be it still probably is delivering babies. It's seeing life into the world. It's seeing families being made. It's being a part of a really special, a privileged part of their lives. And that's what drew me to the field, drew me to it a long time ago. But then you also realize that you're there for them during transition times, and you're that kind of that stable sort of physician throughout their life cycle. And that's such a privilege to be able to walk with people through that time.
You do, especially once you come into, womanhood, and then especially when you get pregnant and have a baby. I mean, I felt like I spent more time with my OB while I was pregnant than anybody else for a long time.
Right. It's a special bond. It's a tightness there that you form.
And they also become, in some ways, I feel like almost like a substitute for a primary doctor, because if you're pregnant, then that is your main go-to, correct?
That's right. That's right. You're their main go-to. You're there to help them in a lot of other sort of primary care ways. They trust you sometimes the most.
Well, and that's good. It can be a good place to be in. So some things that we wanted to really touch on today that I think a lot of people maybe don't ask these questions. They might only be talking to their friends about it. And sometimes I think it'd be good to hear it from a professional. Mm-hmm. So I think for, most women, it starts in pregnancy. And then, of course, as we age, women's health, hormonal changes, all of that gets more complicated. Tell us why and what we need to be thinking about.
Really, for men and women, but particularly for women, and because that's who I deal with, it really is a system. The sexual health, intimate wellness part of her life involves a total system. And that involves her brain, the other parts of her anatomy, obviously, her psychology. And so all of these things touch on women and their ability to have a healthy, intimate life. We know that 5 out of 10 women will struggle at some point with some sort of sexual health issue, whether it be pain, whether it be loss of libido, whether it be inability to have an arousal or have a climax. All of these things, which are very, very important for her life, for her quality of life. 5 out of 10 women will suffer with this. And of those 5 out of 10, only 14% will bring it up to their provider. Particularly, they'll bring it up to their OBGYN if they bring it up to anybody, but only 14% of women that struggle with this problem will feel like they can actually bring it up to their provider, which leaves this huge number of women who suffer in silence. Perhaps they feel shame. Perhaps they're embarrassed. Perhaps they don't know that it's a problem. Maybe they just think it's normal, and that they've just decided throughout the years that this must be normal in the way I have to live my life. So it really is this sort of silent tragedy that occurs with many, many women in society. So we at Louisiana Women's Healthcare want to be the place where we can begin that dialogue, begin to open it up for women to know that, hey, you don't have to suffer in this way. We can help you. We can at least begin the conversation. So that's what a lot of this is about.
That's important. And yeah, your full disclosure, I'll tell you that I had to see a pelvic floor therapist, and Dr. Dickerson, you can maybe elaborate on this, but I remember she told me, she said, it's common, but it's not normal.
Right.
And it can be fixed. So
right.
Do you feel like that kind of expands across any, maybe female, any issue we may be having?
Absolutely. That's a great adage to have in these issues. It's maybe common, but it doesn't mean it's normal. Yeah. It may happen to a lot of women, but it doesn't mean that you should suffer through it. And it doesn't mean there's not a solution or an answer to that. And it's just taking dialogue, and it's taking digging a little bit, sometimes a little sleuthing for both the physician as well as the patient, in order to sort of come to at least a good treatment path, a good plan forward that can help her.
So I think your goal, it seems you want women to be empowered.
Yes.
To feel like they can have healthy intimacy, have a healthy body, and the number one person they should turn to would be their OBGYN.
That's exactly right. What you want her to do is, yes, exactly right, to feel empowered. And more than anything, I feel like my role in this is to educate, which is why I'm so excited to be on your blog today. But just to educate people, to let them know that it's a problem. Is it a problem for you? There can be solutions to this. And so it's about education and empowerment so that people can live their fullest lives.
Yeah. I think a lot of it is just knowing that you're not alone. You're not the only person going through this. And I think maybe as women, sometimes we just don't bring that up.
Right.
And the discussion's not always happening. So then there we are, just like you said, suffering in silence, which is
absolutely. And that's what the statistics show, that people aren't bringing it up. Maybe they'll announce it, put it on a questionnaire, a silent questionnaire later, that they're having this problem, but they just don't bring it up. And that's what we want to be able to be, a forum where they can bring it up.
Which I think is great that we're doing this, because anybody who may feel embarrassed or uncomfortable, I often find sometimes in this sort of spectrum, it's easier to get the information they need, ask the questions, and then hopefully at the end of this, feel empowered to make that phone call, make that appointment.
And really about in the wellness exam that you may have with your gynecologist, just the simple question that the gynecologist can ask: is everything okay in that part of your life, the sexual arena of your life? And that opens up oftentimes the floodgates for her to feel then comfortable to share. So I think it's important too for providers to ask that question: how are things in that arena? This is a safe place for you to discuss these things.
That's great. So what are some things maybe that have become so commonplace for some women that we need to realize, hey, maybe that's not needs to be commonplace, and we can correct that situation? What should we be looking out for?
I think I find the vast majority of complaints that I get from patients, concerns I get from patients in dealing with this is really about sexual pain. You'll find that a lot of women suffer from sexual pain, lower abdominal pain, pelvic pain, vaginal pain. And so that's probably where I spend a lot of my time, helping to try to figure out really what is going on. What is this interplay between the pelvic floor and that intricate arrangement of muscles, ligaments, nerves, vessels, that intricate arrangement, as well as with their brain, their mind, where their mind is their mind ready as well? So there's this interplay between mind and body that oftentimes, if it's not correct, if it's not completely functional, it can result in sexual pain, which then creates what we call a negative feedback loop. If a woman feels pain when she's having sex, then it will trigger in her mind that the sexual act causes pain, which will then bring on more pain. So it's this sort of self-fulfilling prophecy. And so it's important really for the patient and the doctor to sit down and be able to talk about, how do we break that cycle of pain? What is it that's causing it? How can we break it? And so that you can sort of drive through that pain and in order to get it to a better place.
That's unbelievable when you really think about it like that. It's this vicious cycle that if you don't take care of it from the beginning, then it just stems into all of these other emotional things, I would assume.
Absolutely. Absolutely. And I think it's so critical then for the woman it's embarking. She's perhaps newly married and she's embarking on this part of her life or what have you. And she feels pain. And you want to, as I say, nip it in the bud, right? You want to take care of it quickly so that it doesn't begin this self-fulfilling prophecy throughout her life and affect her for the rest of her life.
Wow. And then I would assume, I mean, maybe this is or not after kids, but vaginal dryness or like loss of tightness. Is that something that you hear a lot about?
Well, absolutely. Absolutely. So again, as vaginal dryness can happen to anybody, particularly though it happens to women in menopause, or what we call the period right before menopause, called the late reproductive period or the menopause transition period. But it hits its height in the menopausal period where estrogen levels are decreased. The ovary begins to not produce estrogen in the same amount it did before, and therefore the vagina can become drier, less responsive to sexual arousal, which then creates pain. So yes, you see that a lot in particular age women, though it can happen to women at any age. It's important to ask that question to any sexually active woman, but particularly it affects women who are nearer or in menopause. It also is a big problem for cancer survivors, particularly breast cancer survivors. So there's this silent group of women out there who are struggling, these breast cancer survivors or other cancer survivors in which they'd have to take medications to suppress their hormones in order to arrest the growth of the cancer. And
Right.
they'll find later that, or actually pretty soon after, that they'll have significant vaginal dryness, significant sexual dysfunction. And so she sort of survives this cancer, but then she sees that the rest of her life may be lived in this state where she can't be intimate with her partner anymore, or it hurts her to be intimate with her partner anymore. And so that really, honestly, was a big impetus for me too, to say, how can we help this group of women? How can we help restore a quality of life for them, where they can have this part of their life back again when so much was taken from them? So that really is a big driver for me too, and to encourage those women also to seek out care, to talk about it, to bring it up.
That's important. I had no idea that could affect them, and that's important because, gosh, women who survive cancer. I mean, you've been through enough.
Right.
The last thing you need is another concern.
Sure.
And then talking about menopause, I mean, I'll be frank, I'm almost 40. When do we have to worry about that happening?
Well, the average age in the United States is 51 and a half. Actually, that's what, the average age is. Though we know, most experts recognize that starting around 40, even later 30s, she may enter a period called the late reproductive period. She can still get pregnant. She still ovulates. She still cycles, but it's harder, or it may become a little bit irregular. She may tell you, my hormones aren't quite right. She knows something's changing. And so that will then morph in sort of mid to later 40s for most women into what we call the menopausal transition or perimenopause. And then that menopause is defined as no period for 1 year. And that usually happens to most American women by 51. Obviously, there are people before that and after that, but that's the average age.
Okay. And then speaking of, I know just from talking to friends, I've been through it. Urinary incontinence is a big problem. This was something that I took charge of because I saw my grandmother struggling with this in her 80s because it wasn't addressed when she was younger. So is that something you hear a lot of? And is that something that we need to take care of?
Absolutely. It's one of those common but not normal situations for women. As women age, particularly women that have gone through childbirth, though many studies have suggested vaginal deliveries, though many studies have suggested even carrying a baby, regardless of how the baby is born, there will be a weakening of her tissues that surround her bladder neck. And then what can begin to happen is she'll have leaking when she laughs, coughs, jumps, sneezes, jogs, exercises. And it really does affect the quality of life for people. So there's this weakness that will develop, common, but not normal.
Right.
So that's a big topic and a big source of a lot of research now in our field, and different multimodal approaches to try to help people with that problem.
That's awesome. It must be super common, because I know we see in the women's field, there's all these memes about like not jumping on a trampoline. And
Right.
it's obviously so many women are suffering with this
Sure.
and not addressing it. So that's super important.
Sure. And it affects them, since we're talking about sexual health, it affects them in that sexual arena, how
Right.
they feel, how it functions, what is the laxity of their tissue, what is the overall health of that tissue, how does that tissue function. So there's certainly a component that's non-sexual, of course, with urinary incontinence, but dealing with intimate wellness, there's certainly an intimate involvement with that as well.
Okay. And one thing we didn't touch on was like something maybe more serious, like fibroids or anything along those. What are some things that, if you have some things as a doctor that you say, if these things are happening, you really need to be on the lookout to tell your doctor?
Well, again, in dealing with when it comes to more intimate wellness things, if she's having sexual pain, if she hurts when she has sex, it could be many different reasons. But one of those reasons could be that there is something going on with her anatomy.
Mm-hmm.
She could have some sort of a tumor or a fibroid on her uterus. Fibroid tumors of the uterus are a common reason why women may have sexual pain. And so that's, again, where the gynecologist comes in play. It's important to bring that up to your doctor. Let your doctor perform an examination where he or she can see, what is this uterus? What does her uterus look like, feel like? What's its size? Are there fibroids involved? Endometriosis is another common cause for sexual pain that many women suffer with in silence. And so again, different, we would call them pathologies of the pelvis that can lead to sexual pain. Fibroids being one of them, endometriosis being another one of them.
Okay. Now that we've talked about what do we need to look out for, what we should bring up, say we're in this space where we're talking about therapies and things that we can do. What are some of the things, say, for increasing sexual drive, or
Mm-hmm.
you hear a lot about vaginal rejuvenation. What are some of these things that women can do?
Okay, so when you're talking about sexual drive or libido, that is a common concern for many women. Something we hear multiple times a day, that their libido has decreased.
Mm-hmm.
So again, it's a deeper dive into why, what is going on in her life. What is her relationship like with her partner? How is that going? Because if that's a problem, there will be a libido problem. And therefore, that may be resolved with marriage counseling, therapy in that way. Mm-hmm. But also with libido can also come hormone imbalance. So that's where this whole idea of sort of checking the hormones. Many women will come and say, I need my hormones checked. I'm telling you, my libido is low. My sex drive is low. There's got to be something wrong with my hormones. Mm-hmm. There's nothing wrong with my relationship. I still feel great about him. I mean, we really hit it off well. There's nothing wrong there. There must be something wrong with my hormones. Again, that's where this whole idea of hormone optimization. Okay. As a woman ages, as she goes through that late reproductive period, menopausal transition to menopausal period, hormones change. And we would be looking at, what are her estrogen levels? What are her testosterone levels? What is her FSH level? Is there something that can be optimized with her hormones? And because, we can help her in many other therapies, but if her hormones are not right, if her hormones are not where they need to be optimal for her, then that can be an issue too. So that's a therapy we would look at to help, particularly with with libido. If the libido is a problem because she's having pain, again, that's where we begin looking at what is the source of the pain. Right. That's obviously what's keeping her from wanting to engage in sexual activity. So it's interesting. It's multifactorial.
Yeah, it could be anything.
Mm-hmm.
So say we go through all of that. What is this O shot that people hear about?
So let's say that her relationship is great.
Yeah.
Let's say that her hormones are optimized, her hormones are fine, there's nothing wrong with that. So then we kind of begin to look at what is her anatomy like? What's the anatomy of the genital area doing? Has it been made more lax due to childbirth? Made less responsive due to childbirth? Made less responsive due to menopause? And so that's really where the O shot comes in. It was developed by Dr. Runnels out of Alabama. He coined the phrase O shot. Essentially what it takes is platelet-rich plasma that you draw from the patient herself. You draw her blood, you mix, you spin it down and get her plasma, and you inject that plasma, which is filled with collagen growth factors, a lot of regenerative elements that's found in that plasma, and you inject that after you've numbed her so she doesn't feel it into those vaginal tissues. And that the hope is, and what's been shown, is that it will help to rejuvenate the tissue to make it more responsive, and to make it more easy for her to have arousal and for her to enjoy sex.
Interesting. So many things happening today.
Right.
A whole new topics of rejuvenation and man.
And so it's a wide open space now. Forever we had Viagra for men, and it was sort of, all this research was put into Viagra for men literally decades and decades ago, but women have nothing. Women just had to deal with it. And so now people are finally realizing women are being empowered. Women are talking about it. Women are saying, what about me? What's out there? What can I find? And so there's a lot of research looking at different things, different modalities, whether it be, vaginal rejuvenation using carbon dioxide lasers for the vaginal tissues, whether it be platelet-rich plasma injections for the vaginal tissues to restore health that way, whether it be sonic wave therapy in another device that's used. So there's a lot of different things that people are doing now to try to help to restore that function in that area.
That's awesome. So lots of options, no more just having to, like you say, suffer in silence.
Right.
It's time to take charge of our health.
Right.
So if someone is so empowered and they want to come see you, they want to visit with you, what's the best way?
Well, yeah, we'd love to see you if this is going on in your life, to really begin that conversation, to try to walk down the path with you, to begin this journey, to try to figure out what exactly might be going on so that you can live your fullest life, your best life, your highest quality of life, particularly when it involves intimate wellness. And so please, you could give us a call here at Louisiana Women's Healthcare. It's 225-201-2000. I'm here with 33 phenomenal, fantastic OBGYNs. We'd love to see you guys. We'd love to begin talking with you about this, letting you know what we have to offer. We're all ears. We want to address this sort of other pandemic that's been going on for a really long time.
Yeah, and I think it's so great for women to know this is so much more than your annual check for cervical and breast cancer. Like, we need to go beyond just our basic OBGYN checkup and really look at what's going on inside. And
totally agree. You can bring that up with your provider at that checkup. It may be that you'll need to come back for another visit to really dive in deeper. To begin that conversation is important to say, hey, look, I want to talk about this at some point. Let's bring this up. I'd like to make an appointment to come back in and talk about this thing and see what you guys have to offer. That's
great. I think this was a wonderful conversation, Dr. Dickerson. Really appreciate it. And we want all of the women listening and watching this to feel free to please ask questions. Go ahead and type in that comment box, and we will have Louisiana Women's Healthcare available to answer your questions. And we hope that this, enlightens you and gives women some empowerment to make a visit and come see.
Absolutely. I appreciate you so much having me on today to begin this conversation, to start this topic, throw this topic out. So I'm really excited to hear from your viewers.
Great. Thank you so much. And we appreciate your time.
Thank you.
Bye.